Hi, Dr. Hizon, here to talk about documenting for the patient with obesity or being above their ideal weight. As a general disclaimer, please refer to a particular doctor, as this is a general course not intended to be medical treatment and your particular situation may vary. So symptoms: your body mass index greater than 30 is considered obese or above their ideal weight. And their symptoms can be breathlessness, especially with activity, increased sweating, snoring, inability to cope with sudden activities, joint and back pain, low confidence, and poor self-esteem. The physical exam looks at anthropometric measurements such as their hip, waist, and neck circumference, and they'll look at general skin, cardiac, respiratory, abdominal, and extremity exercises. On the workup, they may look at the history, physical, lab tests, and some imaging tests. The treatment is patient education, behavioral therapy, even nutritional counseling. Sometimes it's pharmacologics, sometimes there's surgery. So lifestyle medicine, behavioral therapies, medications like orlistat, phentermine, and tropramate, bupropion, naloxone, many other ones, as well as monitoring. So usually we start with lifestyle education, such as a healthy diet, meal planning, reduced portion size, increased physical activity, and there may be medications, and follow up with their primary care, medical provider, and or their specialist if they need it, such as an endocrinologist. And usually the chief complaint would be an inability to perform physical activities or weight gain of such and such amount of pounds over the last few weeks or kilos. The history of the present illness would look something like this, where Mrs. Jones is a 42-year-old female with history of diabetes, complains of certain symptoms, but especially here for evaluation of body weight, and they could talk about what she's done so far, her physical activity, timing, quality of any pain that she might have, what makes her weight gain worse, what makes her weight gain better, does she have obstructive sleep apnea, which is very, very common in people who have above their ideal weight body habitus. Do they have fevers or chills, bladder changes, neurologic or musculoskeletal problems, any chronic conditions? And what previous treatments have they tried so far, such as diet, supplements, surgery, exercise, weight loss program, and previous workups such as physical exam, labs, imaging studies? And have they seen any specialists such as orthopedic surgery or endocrinology? And then their general past medical, family, social history, tobacco use, exercise program, obviously nutrition program, sleep program, and then what is their constitutional symptoms been? How much weight have they gained or lost since the last visit? And then step through all of the review of systems. On the objective documentation, typically there's a general line to say if they are in mild or severe or moderate distress, how's their cardiovascular, pulmonary, abdominal, and musculoskeletal. It's not uncommon for them to have osteoarthritis, say of the knees or the hips, and do they have any skin changes, especially darkening of their axilla and or groin. Overall, there's a medical decision-making process. Is this a simple or complicated case? Does it require straightforward or complex decision-making? And this is a chance for your provider to give you the rationale and reasoning for why they diagnosed a certain thing, as well as the treatment program. And so ICD-10 codes, these are several different ones. So E66 is overweight with obesity. E66.0 is obesity due to excess calories. And there's several other ones, especially this is an R code for abnormal weight gain is R63.53. You can look at the plan and the treatment as patient education, lifestyle modifications, some medications that might be used. You follow up with your primary care medical provider, and if indicated, specialty consultation such as endocrinology and cardiology. So in pearls and pitfalls of documenting for the patient with obesity, be sure to document all symptoms and compare the extremities, especially be sure if there's any problems that you get the laterality correct, left or right. Be sure to document all previous treatments. Look at the past medical endocrinologic disorders. Do they have a family history of obesity? Learn the various questions to ask regarding family history, social history, history of the present illness, and past medical history. And please ask your doctor or provider if you have any questions about documenting for the evaluation of the patient with obesity. And in primary care, be sure to document the quality measures on prevention. So takeaway points is that obesity and excess of weight can increase the risk of developing several health conditions. Lifestyle modifications, diet and exercise can be preventative or can reduce obesity. It is important to rule out any underlying conditions such as any endocrinologic disorders, such as Cushing's syndrome or something like that. Learn all the various questions to ask, as well as read up on the recommended diets and exercise regimens that might be used. And in summary, thank you for all you do, because while doctors save lives, medical informatics specialists and scribes save doctors. Thank you.